Most people think blood pressure is just two numbers, but the real message is in the pattern almost nobody checks. One small calculation can reveal whether your arteries may be under strain. Another overlooked detail can matter just as much as high readings. And one quick comparison most people never do can change what your numbers mean. Stay to the end, because the most practical step takes less than a minute. Something important is happening in the few seconds most people spend looking at a blood pressure reading. A cuff goes on, a machine beeps, two numbers appear, and the conversation moves on. If the top number is not dramatically high, it often gets labeled fine and forgotten. But those two numbers can carry far more information than most people realize, especially as we get older. Blood pressure is not just a pass or fail test. It is a snapshot of how your heart and blood vessels are working together in real time. It can hint at changes inside the arteries, how well the body maintains circulation between heartbeats, and whether the cardiovascular system is under strain in ways that do not always create immediate symptoms. That is why relying on a quick glance at normal range can be misleading. Two people can have the same top number, but very different risks depending on the pattern hidden inside the reading. One of the most overlooked clues is not simply whether your blood pressure is high or low, but the relationship between the top and bottom numbers. The top number reflects pressure when the heart contracts. The bottom number reflects pressure when the heart relaxes between beats. That resting phase is not a pause that does nothing. It is when the system is supposed to stay steady, keeping blood flow consistent and organs protected. Here is where the mechanism matters. In a healthier, more flexible arterial system, the arteries expand slightly with each heartbeat and then recoil smoothly. That elasticity helps cushion the pressure wave and keeps the difference between the two numbers within a more moderate range. As arteries stiffen with age and vascular wear, they behave less like flexible tubing and more like rigid pipes. The pressure surge during a heartbeat can shoot higher, and the pressure between beats can drop lower because the recoil is weaker. That widening gap is not just a number. It can be a signal that the system is losing its ability to buffer pressure the way it should. This is why someone can have a reading that looks not terrible at first glance, but still carry a warning sign that deserves attention. Imagine a pattern where the top number stays stubbornly elevated while the bottom number sits unusually low. Many people focus only on lowering the top number, assuming the bottom number being low is automatically a good thing. But the gap itself can point toward arterial stiffness and increased strain on organs that are sensitive to pressure changes, including the brain, kidneys, and eyes. This gap has a name: pulse pressure. It is calculated by subtracting the bottom number from the top number. It is a simple calculation, but it can reveal whether the cardiovascular system is absorbing pressure smoothly or transmitting sharp pressure waves through the body. A wider pulse pressure can be a sign that the arteries are less elastic than they should be, even if the person feels fine and has no obvious warning symptoms. And that is the unsettling part. You can feel completely normal while these internal changes quietly progress. Many people remain active, sharp, and independent right up until a major event forces the problem into the open. This is why learning what a blood pressure reading may be signaling is not about fear. It is about catching patterns early, understanding what they suggest, and having a more informed conversation with a healthcare professional before fine becomes too late. Now that you understand why the gap between the two numbers matters and what it can indicate about arterial flexibility, the next step is learning what ranges are commonly considered concerning and why this warning often gets missed in everyday blood pressure checks. That is why looking only at whether a single reading seems high or acceptable can create a dangerous blind spot. A blood pressure check is not just a number to chase downward. It can be a warning system, and it is often ignored simply because it is treated as routine. What makes this so frustrating is that many of the most important signals are not hidden behind expensive tests. They are sitting in plain sight inside patterns most people are never taught to examine. Start with the simplest signal, pulse pressure, the gap between the top and bottom numbers. A wider gap can suggest that the arteries are becoming stiffer and less able to cushion each heartbeat. When that cushioning is lost, pressure waves travel more harshly through the body. That does not only increase strain on the brain and increase stroke risk, it also forces the heart to work harder against a more rigid system. The body may feel fine while this is happening, but the physics of circulation does not care about symptoms. Over time, repeated pressure surges can quietly wear down vulnerable organs. But the opposite problem can be just as overlooked: a bottom number that is too low, especially in people taking multiple medications. The bottom number is the pressure during the resting phase of the heartbeat, when blood flow to the heart muscle itself is supported. If that resting pressure drops too far, the heart can receive less oxygen-rich blood, even if major arteries are not severely blocked. This is one reason why a person can have a good-looking lower number and still be at risk. It is not about fear, it is about balance. Lower is not always better when it comes to diastolic pressure, particularly in older adults or those with coronary disease. This creates a hard truth that many people never hear. Treatment that focuses only on driving the top number down can sometimes overshoot and create a new risk on the bottom end. That is why both numbers matter, and why the overall pattern matters more than a single isolated reading. A reading that looks controlled can still contain a warning if the diastolic is consistently low or if the pulse pressure is consistently wide. These are not diagnoses by themselves, but they are reasons to slow down, look closer, and discuss what the numbers may be signaling. Another major warning sign is when blood pressure suddenly becomes difficult to control after being stable for years. When medications that used to work stop working, it should not be treated as a simple increase the dose situation forever. Sometimes sudden resistant hypertension is the body's way of signaling a deeper issue that needs to be investigated. One mechanism involves the kidneys. The kidneys help regulate blood pressure and blood volume, and they rely on steady blood flow. If the arteries supplying the kidneys narrow, the kidneys may interpret reduced flow as an emergency. In response, they can activate hormone systems that constrict blood vessels and cause the body to retain salt and water, driving pressure higher. If the underlying problem is reduced blood flow into the kidneys, the body's response can become a vicious cycle. Pressure rises, damage increases, and the hormone signals intensify. Kidney-related mechanisms are not the only possible driver of sudden resistance. Certain hormone imbalances can sharply elevate blood pressure, and sleep disruptions such as severe sleep apnea can produce repeated surges that eventually raise baseline levels. The key point is not to panic. The key point is to recognize that a sudden change in controllability can be a clue that something deserves a closer look, rather than an endless cycle of medication changes without asking why. Then there is the pattern most people never see at all: what happens at night. In many people, blood pressure naturally dips during sleep. When that dipping does not occur, or when pressure rises during sleep, it can indicate persistent stress activation in the body. It can also be linked to metabolic issues that are harder to detect with basic daytime checks. Nighttime patterns matter because the cardiovascular system is supposed to recover during sleep. If it does not, the brain and blood vessels can remain under pressure for hours without relief. Again, this is not a diagnosis on its own, but it is a reason to consider whether the full 24-hour pattern is telling a different story than the daytime readings suggest. Finally, one of the most practical signals is also one of the most ignored: differences between arms. Many people measure blood pressure the same way every time, on the same arm, and never compare. Yet a consistent difference between arms can be associated with vascular narrowing and increased cardiovascular risk. It does not mean something terrible is guaranteed to happen tomorrow, but it can be an important clue that blood flow may not be equal on both sides and that the vascular system should be assessed. It is a simple check, and it can change the conversation from "your numbers look fine" to "let's investigate the pattern." Put all of this together and a new picture emerges. Blood pressure is not just a single moment. It is a stream of information. The gap between numbers, a diastolic that is too low, sudden loss of control, nighttime patterns, excessive swings, and differences between arms can each point toward different mechanisms. None of these signals should replace medical care, and none should be used for self-diagnosis. But they can help you ask better questions, track more intelligently, and recognize when a quick glance is not enough. When you look at blood pressure this way, the goal changes. It is no longer just about chasing a better number on the screen. It becomes about understanding what the reading might be revealing about arterial stiffness, whether the heart is being supported between beats, whether the kidneys may be triggering pressure through hormone signals, whether nighttime patterns suggest the body is staying under stress when it should be recovering, whether big swings point to unstable regulation, and whether a consistent difference between arms hints at uneven blood flow. None of these signals should be used to diagnose yourself at home, and none of them mean a worst-case outcome is guaranteed, but they do mean that a quick glance is not enough. The reason this matters is simple. Many serious cardiovascular problems do not announce themselves with pain or dramatic symptoms early on. They quietly develop in the background, while a person still feels normal. The value of paying attention to patterns is that it gives you a chance to take the information seriously before the body is forced to create a crisis to get noticed. The most practical shift you can make is to treat your readings as a trend, not a one-time event. That means measuring with a consistent routine, recording results, and watching relationships between numbers rather than isolating a single reading. It means calculating the pulse pressure, keeping an eye on unusually low diastolic values if you are treated for hypertension, noticing if control suddenly changes after a long stable period, and recognizing that nighttime behavior and day-to-day volatility can carry information that a quick office check will never capture. It also means using your data to ask better questions. Instead of accepting "looks fine" as the end of the conversation, you can bring your log and discuss what you are seeing. If your pulse pressure stays wide, ask what that might imply and what lifestyle factors could be relevant. If your diastolic pressure consistently sits very low on multiple medications, ask whether your regimen should be reassessed. If your blood pressure becomes resistant after being stable, ask whether secondary causes should be considered. If you have symptoms that cluster at night, ask whether broader monitoring could provide a clearer picture. And if you have never compared both arms, you can do a simple check and then speak with a professional if the difference appears consistent. This is not about becoming anxious or trying to manage everything alone. It is about upgrading how you interpret a test you are already doing. Blood pressure is one of the easiest measurements to collect at home, yet it is often treated as if it only has one meaning: high equals danger, lower equals safe. In reality, the pattern is what tells the story. When you learn to read that story, you give yourself a better chance to stay independent, protect your brain and heart, and avoid preventable emergencies. If this helped you see your blood pressure differently, take a moment to subscribe, like the video, and share your thoughts in the comments. It helps more people find information that can lead to smarter conversations and better decisions.